I'm the PD right now, and I have been for 7 years. I do upper extremity surgery. I'm from here too. I did my residency at the U of S and my fellowship in London, Ontario at the Hand and Upper Limb Center. And I migrated into this role of program director just because I'm enthusiastic about orthopedic education. And I love teaching, and so do most of my colleagues here at the U of S. So we've really developed a strong culture of teaching that started long before I was the program director. And I feel like I should be like Keegan and show a picture of like our forefathers as well, but you beat me to that one, maybe next year. But anyways, it happened long before I took over, and it's still carrying on, and we're just sort of keeping that culture going, sort of fostering that desire to teach and desire to train that we've had here for so many years. So Andrew Ermson is taking over as program director on December the 1st. So he's one of our trauma surgeons, and he's had lots of roles in the teaching program already, and is very ready and prepared to take over the program. We take 2 medical grads per year, Canadian medical grads through the match. And then last year we started taking Gulf State residents. So we took one last year, and we're going to take another one again this year. So right now it's 3 per year. So we sort of have around that 10 or so, 10 to 12 residents in our program. So our program is located in the beautiful city of Saskatoon. It's situated around the South Saskatchewan River. The riverside affords a lovely place to recreate in all seasons. Most enjoy the summer. We have wide open skies and one of the sunniest places in the country. The city has a population of 340,000 and services the northern half of the province with a cap of orthopedic pathologies. And we rarely refer patients out because we have the expertise to deal with any subspecialty presentation. The housing market is reasonable enough that ownership is definitely attainable, and many residents do own their accommodations. The city is large enough to have big city amenities without having a lot of challenges of the big city. And like Justin was saying, if you're commuting longer than 15 minutes, it's pretty frustrating. The majority of the clinical work happens in 3 main hospitals. On the left, you can see the City Hospital. And this is where the majority of the adult elective orthopedics takes place. Arthroplasty, sports, upper extremity, foot and ankle. We deal with the simple to the complex, and we handle all our own revision surgeries. The 2 hospitals on the right are the Jim Pattison Children's Hospital and the Royal University Hospital. So our Children's Hospital is brand new. So they've got beautiful operating rooms and they're spacious. And the University Hospital is a traditional teaching site and handles all the trauma and the spine. And we collaborate well with neurosurgery when it comes to spine care. So these 2 hospitals are located just across the river from each other. So it makes commuting between the 2 of them very easy and allows us to bring residents together on almost a daily basis for in-person teaching rounds. Although we have been largely, we were largely virtual, but basically we're back all in person. And there's actually a teaching session going on right now, which I've taken 2 of my residents away from to come to this presentation. We do have a Friday morning academic half day as well. And getting together in person isn't possible in most other centers in Canada. So we are a program of the University of Saskatchewan. It's our main teaching center for the province. It has a beautiful campus and accommodates 25,000 students. It's got one of the few vet med programs in Canada. It also has a synchrotron, so also known as the Canadian Light Source. It's a facility that shoots electrons around at the speed of light and out into beam lines. So we've done some cutting edge bone research with that. So we create a team environment. Being a smaller program, we obviously get to know each other very well. We look out for each other and take care of one another. And the good of the team always takes precedence over the good of the individual. And we always try to leave things better than we found them. So we have a resident retreat every year, and we welcome the new residents and make them part of the program, which you see in one of those pictures there. This involves relaxation as well as a set of challenges to create a team bonding experience. And here the residents all went to the hospitals around really quickly so they could all get off to the retreat. We have an ever-expanding surgical simulation experience. We have a brand new surgical sim lab, which we're just getting used to. And we're starting with some fresh frozen cadavers and doing orthopedic operations. And then we have, so we take time for all the residents to participate in simulation. Traditionally, it's been mostly sawbones, but we're moving to more advanced sawbones as well as cadaver work. At this point, every resident performs a total knee with their preceptor on a tactile knee model during their first rotation in arthroplasty. You see our surgical simulation spine day there, and we shared that with neurosurgery, which again, we collaborate well with. And then we're just getting on board with our virtual reality simulation as well. There's no shortage of fun activities to get involved in during the summer, and a lot of residents run or bike or exercise, and many bike to commute during the summer months. Walks along a river or walks with your dog at one of our many off-leash dog parks is also very popular. The river bank affords surprisingly nice trails to run or mountain bike on. There are many lakes north of Saskatoon, and many people enjoy boating, fishing, water skiing, or wake surfing, and you can also do lots of wind sports. July brings on our yearly boot camp. We introduce our new residents to fundamental skills related to doing call and emergency care. We also take time to teach the basic topics in detail to prepare our new recruits for their early call shifts, which are done on a buddy system. During boot camp, we head to the operating room for an introduction. We discuss equipment, beds, and positioning. Boot camp also includes teaching joint aspirations, skeletal traction, spine traction, and we include most years in these activities to allow knowledge to be passed down through the years. Winter's no time to stay indoors. It might be cold, but it's usually sunny, and our snow sticks around longer than most places. So fat biking is growing rapidly in popularity, but other activities include walking, hiking, snowshoeing, and cross-country skiing. Each year we get together for a hockey game. No skill is required, and it's all about fun and team building, and everyone's a winner. Research continues to be a point of emphasis. We have increased our funding and research support in recent years, and I've personally given some oversight to some randomized controlled trials in carpal tunnel and presented them at national meetings. We share an annual research day with Manitoba. Usually we get together in person, which means a flight by the visiting program. The Winnipeg program will be in Saskatoon this Friday, so it's just days away. This is a highlight for us in our academic calendar. Residents look forward to this day as they get to show off their research pursuits and encourage one another in future projects. The open skies and flat land lends itself to some of the most gorgeous sunsets around. There's lots of open land to enjoy. And I took this picture of my favorite off-leash dog park in Saskatoon. Our residents have a high rate of success in passing exams and graduating. This starts from a culture of teaching that has been cultivated over the many years of the program. It's encouraged by the team atmosphere that is created early on in residency. It proceeds through residency as residents progress from being a learner to the teacher. It culminates in the final push to the end, which has traditionally been exam preparation. It is also focusing on competency educational objectives at this point as well. Beyond that, you move to your fellowship training and to represent us well in whatever field you wish to pursue. Another thing to mention is we've started Night Float this year, and it's generally been received fairly well. It's really providing an enhanced educational experience when you're not on Night Float, so it's making it much easier for residents to learn. They're not always post-call, so it's made the lifestyle much more manageable as well. I think in terms of Canadian programs, honestly, the programs are all top-notch, and you really can't go wrong. The Royal College of Physicians and Surgeons of Canada works diligently to ensure an excellent educational experience in all areas of medicine, in all geographic locations, and orthopedics in Canada fits that description. The programs in teaching are excellent, and what you need to focus on is the program that fits you best. It's a big life decision in a long period of your life. You want to end up in a place where you can be fulfilled and achieve your goals. So please give consideration in coming to the land of the living skies. We have an excellent program, a great team atmosphere, a strong culture of teaching, and a great quality of life. This concludes my part of the presentation, and I will hand it over to Liz and Colleen to give a few comments.
Hi guys, I'm Liz. I'm one of the R4s from the Saskatchewan program, and this is Colleen. She's one of our R1s, so you can kind of get two different perspectives here. But from an R4 perspective, I really can't stress enough that our team is like the best team that I have experienced, I think. But I think we're very close. We have a very small program. We have around 10 residents total for all the years. So we get really close. We know each other well. We're a really good support team here. We get together and do lots of social things. So like we saw in the presentation, we have our annual resident retreat, and then we have our R5 send-off in the summer. Sorry, my computer doesn't pick up the audio sometimes. And then throughout the year, we have various social gatherings. We have like wing nights and get-togethers, and we have lots of fun together. And then on top of that, since we have very few number of residents, our staff get to know us really well, and they even have us out to their houses and stuff for social gatherings and journal clubs, and they're also a really great source of support. And then even on call, when you're a junior resident, our staff are always available to talk to you and help you overnight for a phone call away. And then our senior residents try to provide as much support as possible too, just the same way. So we get really close, and I think that's probably the best part of our program. On top of that, we have this little room beside the OR called the planning room, where our trauma team hangs out, and everyone likes to stop by and say hi, and just because we like each other and we like to hang out. So that's kind of what I think is probably the best part of our program. And Colleen will give you a little bit more about the R1 side of things, but yeah.
Yes. So it's always tough, especially I was in like the COVID years, so I didn't get to travel to different places. And I'm originally from Calgary, and Saskatoon was actually my first choice coming out of CARMS. And this was before I knew what wonderful people I would be working with. And really what Liz says is exactly right. I got the vibe that the residents were really supportive of each other, and that's exactly what I found. But what really attracted me to the program, and is like very true now that I'm here, is the way that this program really prioritizes their residents as, you know, learners and people that they want to see develop into surgeons. And they do that by having our sessions, which are really respected by staff. No one will ever tell you to like skip a teaching session because you're doing service work. They take the calls during the day so we can focus on operating or doing consults, and they're the first call for consults when we're on call, which is a huge burden off of us. So that has contributed greatly to the way that I feel that I'm able to just be immersed in the learning that I'm doing. The night float has been really beneficial as a first year. I'm able to be on my rotations when I'm on them. I'm not missing all these days for post call. So that has been a great change that I have been able to benefit from. And then lastly, like Dr. Sauter was saying, living in this city is so easy and fun when you're trying to take on the rigors of an orthopedic program. Like I live 7 minutes bike from the hospital. I haven't used my car yet, although the winter will challenge me. I was able to find accommodation at a good price. When we have our teaching, the two hospitals are like 4 minutes away from each other. So you're not running across the city afraid that you're late for your next like session after you have teaching in the morning. It's very easy to get where you need to go. And then we do have like a beautiful river valley that I've taken advantage of running and paddle boarding, and all of the like amenities of the big city that, but none of the stress. So it's been great. Really highly recommend it.
Yeah,